Well, hello, this is Dr. Amig, your friendly rheumatologist, and this is part two of lupus and SLEs particularly. And today we're talking about the management of lupus. So the first thing is because, as we mentioned earlier, and if you haven't watched, I recommend you watch the first episode about SLE on how we diagnose it and how it presents. So because it is an autoimmune disorder, what we're going to look at is how to take care of the flares, how to make sure that the flares don't happen, so how to prevent it, and how in general we're managing lupus. So this is what we're going to learn today. So the first thing is to realize that because it's an autoimmune process, what you want to do is to lower this inflammation, this autoimmunity, right? So we're wanting to basically restore the balance of your body, basically, right? And there are many ways that we're going to do this. I'm going to start first with what you can do, or what you can try to do to prevent flares and to, decrease the inflammation of your body. Then we'll go into what type of medication we use, and we will close our talk then. Okay. So the first thing is because it's an inflammatory process, there are things you can do, and it's very well documented and researched to prevent flares. The first thing is to try to avoid sun exposure. So we know that the sun damages the DNA inside of your cell, all of us actually, outside of our cells. And in patients with lupus, it can cause flare. Okay. So you really want to make sure that you don't go out in the sun. You want to make sure that you have a big hat, that you have sunblocks and like more than 60 SPF, that you are wearing long sleeve, and that you're really trying to avoid the sun at all costs. And that is not really fun, but the truth is that it is possible, and you can then go later on in the day to see the sun. It will prevent flares. That's really important. Second is tobacco. You have to try to stop and quit smoking. For those of you who know me, you know that I'm French, and like a lot of French people, I used to smoke. So I know how hard it is. I still would tell you that I love smoking. It's just that I don't do it because I think it's not worth it. And really take at heart the fact that yes, smoking can be good for you, like in the sense of like it makes you feel good or you like it. But if you have lupus particularly, it is not good for you in the long term, even in the short term. And you're going to have to work on quitting. And it is hard, but it is so worth it. And I'm already proud of you because I know you're going to quit. All right. So quit smoking, no sun exposure, avoid stress. This is a hard one, right? Like it's easy for me to say, oh, avoid stress. The truth is that stress, I mean, it's not like we put ourselves in a stress environment on purpose. So avoid stress means that maybe you work on mindfulness exercise. So maybe you want to meditate, you want to breathe. When something stresses you out, just like take a deep breath, work on those exercise, try to meditate. You can really just breathe with your nose very deeply. Try to make sure that nothing affects you. Better said than done. I know it. I'm just telling you because now that you know, you're going to make a plan. You're going to take time. You're going to take energy to actually do meditation. I recommend meditation every day for at least 10 minutes per day. I do it. I love it. I used to never do it. I'm a type A personality. So stopping is not something that's natural to me. Yet I do it because I see the difference. And there's so many studies that are showing that it really does help. Okay. Those are the main one. Try to not do like when you're doing exercise, you're making sure that you're not over exhausting yourself. You want to make sure that you're well hydrated. And then, there is some studies that are showing that having a balanced diet is also helpful. So those are all things that you can do. And then there are the medication word, right? Always remember that our medications are very powerful. There's no question about that. We're in 2023 and we have amazing medications, but they're really here to help your body heal. It's not like we're not saying, oh, the medication is going to do it all. You need to be fully on board with the medication. And honestly, you can do all of those previous things as well. It's really just 1 + 1 = 3 and not 2 because it's symbiotic, right? It's together. So the medications we have are very exciting because we have a lot more now than we used to have 10 years ago. And in general, the goal of our medications is to lower the over inflammation that you have, like this sort of hyperreactivity of your immune system, lower it to back to balance. And the first step, and all of the patients who have lupus should be on it, is to start with plaquenil or hydroxychloroquine, which is an anti-malarial. So it's an anti-malarial against malaria. It doesn't work for malaria anymore because malaria has created a resistance, but it works for lupus. And there's many studies, including some that I was involved in, that show that plaquenil prevents flare. Plaquenil or hydroxychloroquine prevents flare. And so everyone that does not have a contraindication for plaquenil or hydroxychloroquine should be on it. Okay, so that's really important. The good thing also is that it's not immunosuppressive. And so it's really just reestablishing the balance. And so it's an immunomodulator, but not immunosuppressive, which is very exciting. The other medication we're going to talk about all are immunosuppressive. And basically, we use them when we have to, meaning that there are a lot of people with SLE or lupus that do not need them. A lot of people are only going to need plaquenil, and that will be enough for them. Some other people are going to need steroids, so that's like prednisone, methylprednisone, and so on. So steroid, we don't like steroids. We like it because it works very fast, but we don't like it in the long term because it has many side effects. So when you're starting steroids, if you're ever starting steroids, and hopefully you don't have to start steroids, know that there has to be a time limit to it, and that your job is to always try to decrease it. Okay? But sometimes you have to be on steroids because you have life-threatening or organ damage that we want to reverse as fast as possible. Remember the idea of the fire. If there's a fire, you're not going to take a pipette with a little bit of water every time. You're going to put a bucket of water and then you're going to back off. Okay? And that's what we do when we need to have steroids. We are putting water in the fire and then we're backing off as we have controlled the fire and we don't need as much medication. So steroids. So then we have azathioprine, mycophenolate mofetil. We also have methotrexate. All of those, they are decreasing your immune system sort of in a broad way. And they are like the oldest drugs. And then we have biologic agents such as Benlysta or benlimumab. We also have Safnelo and anifrolumab. Those are like the newer medication, and they work really well, especially for patients who have joint and skin involvement. Some patients are going to need rituximab. There are some studies that are showing that it does work. I'm a big fan of Rituxan, but in certain type of context for lupus, so not in all of the contexts for lupus. And then when that is not enough, or if you have really severe form of lupus, we may use actually really a chemotherapeutic drug called Cytoxan, but it's in really specific cases. There are patients that are very severe lupus, and so it's not the vast majority of you. The vast majority of patients do not need anything like this, but some patients will need bone marrow transplant, and there are some bone marrow transplant that can get you in full, almost like cure, because we usually don't say that you can cure lupus, but it sounds like, and it looks like maybe bone marrow transplant and CAR T cell could actually cure lupus. But remember, those come with, it's very risky, so we're not offering them to everyone. I think overall, that's what you need to understand, is that when you have lupus, the goal is to reestablish the balance, that there are things that you can do, and there are things that medicines can do. And put together, they really help you be in what I call remission, because you have no more symptoms, no more signs of disease, and that is what we're aiming. Cure is not a word that we use for lupus. That's really important. It's not a word that I use for rheumatoid arthritis either, but we can use remission, because remission is the absence of symptoms. Okay? And that we can aim for that. And so you should always aim for that, with really this balance of what are your symptoms and how much immunosuppression do we need to get you to full remission. All right? If you have any question, don't hesitate to ask me. I would be happy to answer them. If it's a medical question, in general, I will always tell you, yeah, in general, this is what we are looking at, but I will always say, go and talk to your rheumatologist. And if you have more rheumatology questions, don't hesitate to ask me. I'm Dr. Amik from Onabridge MD. We are the first direct care concierge rheumatology practice in Colorado, and it is very exciting, and I'm very happy to bring you Rheumatology 101. See you next time. Bye-bye.